outpatient mental health services. So, and you may have covered this. This is really just clarification. So, I saw the date 11/23 is when we can begin requesting authorization for continued mental health services that are expiring. When you say expiring, are you referring to when existing patients run out of the 24 or 22 Magellan authorized sessions? Are you talking about some other expiration?
So there are two kinds of expirations. There can be an expiration, a date expiration, right? There could be a date on authorization, and also there's another number of units. All right, so if you need, if they are running out, the units will be running out on or after December 1. Is we're going to, through the 30th of November, if it's outpatient, is you will automatically get units equivalent to what they got in November for the month, the pro rata share. But you're going to be asking for authorization beyond December 30th going forward. Now, if you need more units for someone they have had a change than they had in November, then you would need to have that authorized.
Okay, and you mean beyond the 24, or you're talking?
No.
My understanding is that the units are going to be different when the 5 plans take over. That there will no longer be 24 automatic sessions.
I mean, they will each have their own prior authorization requirements, but during the grace period is that you will not need to get more units before December 1 through December 30, but we'll restore the same units that you had in November.
Okay, and just one more question. So it starts on the 23rd that we can start requesting. Right now, the system that's in place with Magellan is cumbersome in that a therapist has to get on the phone to get more sessions for their clients. And our therapists are saying that sometimes they're on the phone for 30 minutes waiting to talk to someone or waiting to go through this process. So let's say at this point we have multiple patients, multiple therapists, and then potentially multiple providers in 1 week before December, from the 23rd to December 1, requesting. It just, I'm just concerned.
So we actually met with Magellan yesterday, and we have finalized a process to expedite those requests that they're putting in place today. So I expect to see some changes on that front. I have a couple of members of my team. We've got from the Office of Behavioral Health some of the Deputy Assistant Secretaries. Ms. Reeves is here. Some Medicaid Deputy Directors who may, and Darryl Montgomery, who is a clinical social worker on my team, and Dr. Savicki may need to be on standby to help with some of the questions. Next question, do we have other questions?
Yes.
We will be around for sidebars afterwards. We're not going anywhere. We have nowhere to dash off to until 3:30 this afternoon to Hammond. Go ahead.
I don't think it's on. Is it on? Okay, my question is that you said the mention of November 23rd date. The bulk of my clients are with United Healthcare. I haven't had any contact with them as it pertains to my applications and being credentialed. I talked to the ladies outside about the situation. However, if that's where the bulk of my clients are, how will I be able to submit those authorizations so that I can start getting approvals for them?
What I want you to do is talk to the people from United Healthcare while you're here and give them your information so they can follow up and see why it hasn't been completed, because I know they want to get that completed. The I's dotted and the T's crossed. You go ahead and touch base with them and find out so they can tell you the status. Now, my number one concern is that they may not have something that they need. And so, United, can you get with her and get her information and follow up with her?
And the next question would be, how do we get client numbers and ID numbers so that we can go onto the portals for No, will they vary from organization to organization? Some have stated that we would have to have we won't be using the SLA number anymore. We'll be using the member number or some other number. So will it vary from one person to the next? And how will we know what numbers to use when it's time to submit those authorizations?
You know, on the that one pager that each of the plans is preparing for their contracted providers, we will ask that they put that information on what number is used for the provider portal, okay? Do we have some cards with questions? So this question is, which is the default Bayou Health plan for members who do not choose a plan? There is not a default plan. We use a number of factors. If other family members are in a plan, that could be a factor in assigning someone to a plan. If they have been in Bayou Health before, that could be a factor. We'll put them back in that same plan. And then there's no one default. We just do what I call round robin. Go down the list. 1, 2, 3, 4, 5. Back to the top. 1, 2, 3, 4, 5. So there's no single default plan. The website where the PowerPoint slides are going to be, it is www.makingmedicaidbetter, all one word, makingmedicaidbetter.com, www.makingmedicaidbetter.com. And will prior authorizations be required for CPST, PSR, FFT, MST, and home builders? For some plans, I know the answer is no, because I've got a handout out there that says no. For some plans, the answer may be yes, but it is going to be up to each health plan to decide that. Will plans require both a locus and a separate assessment, or just the locus? Our contract currently with the health plans says that they must obtain both a locus and an assessment, have an assessment completed. So the answer to that would be is that that decision is not their decision. DHH made that decision to require both that assessment and the locus. Any other cards that anybody has?
We have quite a few. I didn't know if we had time for them.
About someone asked, we've been working and planning on credentialing with the new providers, and still, all caps, underline, still have not been confirmed. Can this be improved? I sincerely hope so. And that is what I would do. We have on that website a one-pager, which is the primary contact for each of the network leads for each of the 5 plans. But my suggestion, if you're still in the room, don't leave here without making contact with every one of them and telling them you want to know by the end of the week the status of your credentialing. Number one, do they have everything? That's the first thing to verify. And then number 2, when you can expect to get the feedback. As they are reporting to us every week on how many are still in process, how many are completed, and we're closely monitoring that. But I know that it matters, because in order to be able to get access to their provider website, that kind of thing is you have to have completed that process. So we know it matters, and we're monitoring that closely. And if you continue to have problems, you can email us, you can put it to my attention at bayouhealth@la.gov.
Do you want me to read them?
Go ahead.
Okay. Pathways is no longer doing 1915I. Is there another agency in Baton Rouge that's doing them until the change, or until 12/1?
For renewals, there's 2 answers. One is for new applications, new requests, and one is for renewals. For renewals, the providers will be able to do the assessment and the locus. Magellan does have capacity, they have assured us, for new requests. And if that is not the case, you need to let us know.
Without freedom of choice, how do members select a provider for CPST, EPSDT? How is provider informed if client has selected that provider?
Don't know now because we have offered freedom of choice, the freedom of.
So,
Well, what happens is what happens is there is freedom of choice when it comes down to selecting the provider. A recipient always has freedom of choice when selecting the provider who is to provide their services. Now, what happens when we go to CMS and we either offer managed care either through a 1915B waiver or through a state plan, and children obtain managed care services through a 1915B waiver if they have special needs. We get a freedom of choice waiver from CMS that allows us to restrict the number of managed care entities that we can offer services to. But a provider from whom a person is able to select services from is always guaranteed. So a person can always select who they want to provide those services from. So the individual provider is where the freedom of choice comes in. Yes.
It will be with one agency. Which is CPST providers. So how will agencies know if they've selected a new provider, when they should stop billing? Mechanism, I guess, that works.
Well, that's not the purpose of the freedom of choice. It was being used for a purpose for which it was not designed, if that's what it was being used for. So it's going to be based on whether or not if it's something that requires authorization. If you actually deliver services, will the plan pay for them? But we're going to take that. It's a very good question that hasn't come up before. And a lot of these are questions that are new for us, and so we're going to be working to get these answered rapidly. We can't afford, and you can't afford for us to sit on these for weeks. So our goal is to get these pushed back out. Here's one. Where do we get information on locust training? My advice is if you need locust training and you're contracted with one of the 5 plans already, is tell them that you need locust training and ask them when it is. Some of them have said that if there's one plan that said if they've got more than 5 people at one location, they'll go to you and provide it. So, but talk to them about maybe some that are, regional or y'all are all in Baton Rouge, but some of them are going to be going to the places, outside Baton Rouge and New Orleans to do training. So that'll be offered as well. So go ahead, Daryl.
So regarding locust training, so that you don't have to keep doing it for the different health plans, OBH will maintain a registry. So they'll know and report back to the health plans who has already been trained.
That's a good point. We've got a list with the names of lots of people that have completed locust training that our Office of Behavioral Health has maintained, and we are providing that list to each of the 5 plans and encouraging them to put it on their secure website so that you as providers can check and see whether someone is on the list as have already completed locust training, and they would not need to be retrained. So we will take these questions. I know that my voice is playing out, so this is about all I'm going to be able to do today through the mic, but I will be available for one-on-ones, as will my staff. All right? And we appreciate you so much. If there's one takeaway, it's how much our Medicaid enrollees value providers and depend on you for their information.